We're in the dead of winter season. It's cold and at times wet or snowy. It's also the perfect time of year for many sicknesses to percolate, like RSV.
RSV is most prevalent in the winter times because it spreads by droplets. And in the winter, most people are starting to get inside, get close together, and it's easy spread that way.
Dr. Leverton says RSV is a virus that affects both adults and children, but can be more challenging for older adults and babies. The symptoms mimic those of the common cold, but there are some differences.
Typically on days 3 to 5 is when it's its worst. You might notice everything starts the same: cough, runny nose, decreased appetite, and then it starts to become a bit worse. As it starts in the upper airways and makes its way down to the lower airways, you might notice that the baby or the child is breathing harder. You might notice noisy breathing, and you might see their ribs working and their body trying to create pressure to help them breathe.
If you see these signs, it's time to head to the doctor. Dr. Leverton says while there's no conventional treatment for RSV, there are ways to support a loved one if they become infected.
So the treatment for young babies and young kids is all supportive. Suctioning their nose frequently, making sure they stay hydrated. If they have asthma or reactive airway disease, if they start showing signs of runny nose, cough, starting them on their albuterol and scheduling it every 6 hours can help prevent it from getting worse.
The best ways to prevent RSV and other illnesses:
to practice good hand hygiene and to avoid people who may or may not have the illness. If someone's sick or coughing, having fever, probably not best to hang out with them. The thing to do is if you know your kid is sick, don't send them to daycare. Keep them away from spreading.
In Amarillo, Rochelle Hamilton Jr., KAMR, Local 4 News.